Hello. Hi.
Hello, Dr. Cheryl. Welcome
Can you
to
hear me?
the. I can hear you. We can see you too. Are you able to hear me?
Yeah. Can you hear me well?
Yeah, I can hear you.
It's perfect. Okay.
Okay, perfect.
Nice
Welcome to the
to meet you.
Instagram live session. Are you able to hear me, Dr. Cheryl?
Yeah, it's perfect.
Hello.
Hello. Yeah, it's perfect.
Okay, great. So, welcome to the Instagram live session. We can see you. We can see you, Doc.
Yeah.
All good?
Yeah, all good. We can start.
Okay, great. So, welcome to everybody who's watching the session live. I'm Dr. Trishala Chopra. I'm a functional and a lifestyle medicine expert. And we have Dr. Cheryl with us, and she will be sharing her specialization. So, Dr. Cheryl, can you please share your specialization with the audience that's watching us live and the people who will be watching the session after the Instagram live is done?
Okay. Hello, everyone. I'm really excited for this Insta Live. I'm Dr. Cheryl Kachpille. I'm a cardiorespiratory physiotherapist. I've done my master's from KM in cardiorespiratory and physiotherapy. I have my cardiopulmonary rehab center in Vasai, where I specifically deal with patients with heart and lung conditions, diabetes, and vascular conditions. And when I came to know about this episode, what we are talking about, breathing through the night, or it was really excited to tell people how important it is, to be aware of your breathing, specifically in day also, and of course in the night. So yeah, thank you so much. And I invite everyone for this. So thank you so much for coming.
Thank you, Dr. Cheryl. And the specialization itself makes us think a lot that how much of these issues are not really addressed to the normal population. So I'm so glad that we are doing this. And there might be many people who might not be able to join us live for this session, but this session will be recorded and the link will be shared across. So it will be a good informative session for everybody. Great. So, Dr. Cheryl, this brings me to the point of the entire topic that we're discussing, right? Breathe through the night. So, some people might just think that this live is about teaching them how to breathe, to meditate, and etc. But as we know that this is not about that, this is something completely different. So, tell me one thing that you're very commonly seeing in your patients these days when it comes to sleep or breathing, etc. We would like to know your experience.
Okay. So when I started my practice specifically, like I've been practicing in this field since 3 to 5 years now. So what I discovered when I take the history was, sleep was something which was a major factor. Chalo, dusra condition to hai, like, they have diabetes or they have asthma, they have any lung disease or heart disease. But along with that, when you were talking about how's your sleep, just a question, and they're like, it's disturbed. And then what the second question came was, do you snore? And they're like, I don't know. And then I used to ask their partner or their family member. And they're like, yes, they snore. Do you wake up in the morning with a dry mouth? And they are like, yes. So there are multiple factors which came in when I was talking to them. So that is the reason we are discussing why sleep and how's your sleep pattern, your duration is important.
Absolutely, Dr. Cheryl. And I've been in this field almost for the last 10 years, and I'm seeing so many patients recently coming up with sleep disorders. And something which is very funny is people think that snoring is normal. So when they are snoring, they are actually having a good deep sleep, is what they feel. So the moment I ask them, are you snoring? And they say, yeah, my sleep is not a problem. I can sleep anywhere, anytime. Even if you give me a chance right now, I will sleep right on this call. And then it comes as a realization that, hello, this is not normal. Okay, snoring and sleeping anywhere, anytime is not normal. So for our viewers, if you experience snoring, mild snoring, loud snoring, but your partner is getting disturbed, or you have symptoms like you can sleep anywhere, anytime, it is important for you to take the help, because me and Dr. Cheryl, we come across this very frequently in our practice. And now I have actually come to a point that I don't take the conversation forward unless I completely address the sleep issue. So, Dr. Cheryl, what do you think could be the causes of snoring and etc. coming up in the recent years, especially the more I'm seeing after COVID?
Okay, so majorly it's the lifestyle diseases which are coming, and that's the main thing is about hypertension and then diabetes and then obesity. Because many of my patients who, I wouldn't say patients, basically members of our team who visit us for rehabilitation, so major factor is uncontrolled hypertension. For example, I would say, like I have this one of this patient who visited me the other day who had high blood pressure. He was on medications but not under control, not regular, and then his sleep was disturbed. And when I was speaking to him, what he mentioned was, his BP is not into control, and there is a lot of obesity factor, fat deposition in the neck area, and then he was snoring a lot. So I think diabetes, hypertension, obesity, they are the major factors which are, and if it is combined with any lung condition, then it is, it's more difficult to overcome that, I would say.
Yeah, absolutely. And since I deal with a lot of metabolic disorders, right? So just for the viewers, metabolic disorder is anybody who's going through obesity, hypertension, diabetes, all clubbed in together. So these are definitely the factors that are coming across. But what I feel is that this is taken very lightly. People are not really understanding that how fatal snoring can actually be. And I would just like to share this with the people who are watching us, and later the ones who will be watching us later, that I recently went on a trip, and where our tour guide was actually discussing about making fun of his wife, basically, that she snores a lot and we cannot sleep next to her, and she's very tired and all the time she keeps sleeping. And these symptoms were a red flag for me. So I was off duty though, but these symptoms, I couldn't stop myself, and I had to tell him that this is not something which is normal. It is important for you to get this checked and take this seriously. And poor guy, he did take this seriously also. So I'm talking about somebody who was in Nainital. I went to Jim Corbett and tour guide, etc. And with the level of intensity, the symptoms which he was explaining it to me, I really felt that something is not right and this required urgent help. And sadly, we lost the patient in literally 2 months after I spoke to him. So we tried our best, but we were not getting resources that could reach Nainital, because it's a small place, etc. I literally tried my best, but we lost the patient to who was just giving us the symptom of snoring and sleeping anywhere, anytime. So what exactly happened there was that when you're snoring, I mean, Dr. Cheryl, you can help us more with the mechanism of what actually happens, but in extremely layman terms, she was not able to breathe and she got into a cardiac arrest. So Dr. Cheryl, can you just share few examples with us that what exactly happens when a person is snoring and why it is something that has to be taken seriously?
Okay, so coming to this point, see, when we think about breathing, or when we think about, we are breathing deep or we are breathing well, we always think of our lungs. But if you think properly, our respiratory system is made up of two parts, like the upper respiratory and the lower respiratory. The upper respiratory consists of your nose, your throat, and the lower respiratory is majorly your lungs and the pleura and, the diaphragm. So when it comes to snoring, it's the obstruction, or we can say partial obstruction to be very specific, of the upper airways. Okay. So the first thing is the person, like it becomes difficult for the air, what we breathe, to pass through the nose. There is a lot of resistance that takes place, and there is partial obstruction. Okay. So imagine, like there is a lot of fat deposition, and the pathway towards your lungs, it's obstructed. So it becomes like this. So when your air moves inside, there's a turbulence, what you say, which can create, and there is a sound which creates, and that is called snoring. Okay. There are multiple reasons. For example, if there's a deviated septum, the nose, in nose, So even when the air passes, there can be a snoring. For example, that is one. Second thing can be deposition of the fat. Multiple reasons. Example, even when we are too stressed, what to say, we had a bad day and we're very stressed and tired. At times we snore. Why? Because the muscles of the throat, I mean even the tongue muscles, they are in a very relaxed phase, what you could say, or else they are weak at times. So that is the reason snoring occurs. And that is the time when nose breathing comes into picture, why nose breathing is important. And so I think that is what to say. Snoring is nothing like what you can say, it's a disease, but it is something initial symptom. But if it becomes chronic, if it becomes, it starts giving you harm, or else your sleep gets disturbed, you get up in the night too stressed up, achanak se you get up and you're like suffocated, or else in the mouth, you just get up, you need water. This is some symptoms which are not really working great for you. You need to consult a doctor, you need to consult a physiotherapist. That is how it is.
Absolutely, Dr. Cheryl. So, just to summarize this for the audience, is snoring is something which is not supposed to be taken lightly. So, if you are experiencing loud snoring, if you are waking up for frequent urination at night, even
That's
without drinking a lot of water before bed, if you're waking up very tired, like you haven't slept despite sleeping for 8 hours, you're waking up with a higher blood pressure, these could be the signs of undiagnosed obstructive sleep apnea. So this is what needs to be checked. So you can get in touch with a physiotherapist, you can get in touch with a metabolic doctor, a sleep coach, a chest physician, to figure out what exactly this could be, because this is probably affecting your heart, and it is going to be something which might be fatal if not addressed for a longer period of time. And in America, we have almost 70% of the road accidents happen due to undiagnosed sleep apnea and not alcohol. So this is like a big number, and we are noticing this even recently, Dr. Cheryl. I mean, in India, the number of road accidents, especially at night, they're really going up. And the only reason that, or anything that comes up in the media, is somebody slept on the wheel. So this is something which is now catching up, and I'm seeing a lot of these cases post COVID. I mean, I do had cases with sleep apnea even before COVID, but something has just gone wrong in the last 3 years. So what are your views in this? Are you experiencing the same? Are you getting the same patient population and the cases are going high in the last 3 years?
Yes, I would like to share a few experiences. For example, daytime sleepiness is something which we take it easily. If you have other conditions like diabetes, high blood pressure, even after medication, things are not being settled, you need to consult your doctor if you have any obstructive sleep apnea issues. So daytime sleepiness is one of the symptoms of obstructive sleep apnea. It can be the start. No one diagnoses you at the first state. There are few symptoms your body gives you. Always remember, there are like snoring, or suppose if you have a nose block, you also snore at times. That is something which can be reversed. But if it becomes a chronic thing, you need to consult a doctor. Post COVID, of course, there is a lot of what I would say stress related issues which have been occurring. So I had this one of my patient who had continuous breathlessness and snoring and tiredness in the day. Everything was normal. His X-ray was normal. He was improving well. Oxygenation was good. But the daytime sleepiness, tiredness, that was very common in him. And then we did a sleep study. There was obstructive sleep apnea, which was diagnosed. So there were important things which we need to consider. And stress itself makes you more prone to conditions, lifestyle diseases. So I think it's very true, even in the post COVID era. And what to say, every other person in the family might be snoring. For them, actually, I would say, how to be fit and why to
Yeah.
exercise is something where it comes into picture.
Yeah,
That's
yeah.
true.
It's become very normal. So snoring is like, ये तो करते रहते हैं, इनका तो snoring चलता
Exactly.
रहता है. But
Exactly.
certainly
Exactly.
when they talk about it so casually, I literally, I'm actually judging them. I'm actually judging
That is
them that how they have
yeah, that is
made it so common, and they're making jokes about it. But a person can lose its life. I mean, person can literally die if you are not diagnosing the sleep apnea. So I'm glad, Dr. Cheryl, that we are having this conversation, and I want more
yes,
and more therapists to talk about it, because this is something that
exactly.
has to be addressed, and it really makes me very sad. So I have a patient come in with a problem of obesity and tried all the diets, unable to lose the weight. And then this random question comes in that, how's your sleep? And then they look at me that, why is she talking about my sleep? I'm here to talk about my food.
Exactly.
And I take the conversation completely away on sleep. And the summary of the call is that, let's get a sleep study done. And maybe this could be the cause of why you are unable to lose the weight in spite of doing everything. And I have had so many patients, Dr. Cheryl, in the past, that they did not change anything in their diet. They were pretty much eating the same food. But the moment we got them treated for the sleep apnea, they actually started losing weight. And it was so surprising for me that what is this? Okay. I mean, why is everybody not doing it? So I'm
Exactly.
so glad that, you just mentioned that people take daytime sleepiness like, okay, I'm tired, or office mein zyada kaam tha, ya aisa tha, waisa tha. But if it's getting prolonged, it's supposed to be discussed with your health coaches, doctors, physiotherapists, and we have to get this treated. We are not okay affording you sleeping on the wheel, because you probably have a family waiting for you. So it's not just drink and drive always. So many truck drivers, they sleep on the wheel. People are not sure what happened, and it's very sad that what exactly is going on. And when Bappi Lahiri ji passed away last year, this topic was a big discussion everywhere, and the media was picking up, and articles were being posted that what it could be and why you should get this treated. But again, that incident happened. It made us remind what it could be, and then it's over. It's done. The topic never came back again unless somebody will go through it, right? So we need to
Exactly.
reach the masses. We need to reach the audiences that you please take snoring seriously. I have seen people losing lives. I've seen young people dying because they couldn't treat their sleep apnea. Probably even the doctors need to be focusing a bit more on the diagnosis rather than just focusing on what medicines to prescribe. Instead of
Exactly.
increasing the hypertension medications 1, 2, 3, we should take a step back and see that what could be the reason why this patient needs more medications, right? So that is something that we need to do. So again,
I would
I'm
just, yeah,
yeah,
yeah, I would just like to add on to, as you said, so as you had this patient who never focused on much of the diet part or exercise part, but when you started treating the patient
yes,
for sleep apnea, things were more simpler. So just to add on, I have a patient who is post-COVID. She's of course quite obese. Her weight was 129
mm-hmm.
kgs. Okay, so and she has multiple issues like
Yeah,
knee arthritis. So I actually can't give her a vigorous training like treadmill or walking is very
correct.
difficult considering her age and considering her factors. But with the time, and she's a obstructive sleep apnea patient, quite diagnosed from long years with BiPAP on, a CPAP on continuously. So when she came across me, she was quite surprised that there are exercises for sleep apnea. And of course, I didn't focus only on that part. I was treating her as a whole pulmonary
Yeah,
rehab per se, breathing exercises.
yeah,
Since she had post-COVID fibrosis, she's on oxygen therapy. But to my surprise, I would say, and of course, diet is something which was difficult for her
yeah,
to follow. Exercise was something which is difficult to follow, considering of overweight, considering a
yeah,
knee pain. So all that I did was, breathing exercises for sleep apnea, which really worked great.
yeah,
And to my surprise, in 5 months, she actually lost 8 kgs.
yeah,
And this was quite, and she could actually feel the area, the circumference around the neck reduce, the fat
yes,
around her, upper back reduced, and she was feeling more relaxed. And she was not able to sleep, straight because
straight.
of the CPAP on. They are not able
Yeah,
to breathe well, but she was able to now because her upper
yeah,
airway was quite relaxed and more
yeah,
breathing well. So I think it has amazing effects, just small, minute things which makes
yeah,
the patient happy because you have CPAP continuously, okay?
yeah,
But then, you have to find a way to get out of it and breathe well. Not, you can't take it out fully. But there's a point where you get some relief as she
yeah,
had. So I think
yeah,
that's really wonderful.
absolutely. And so for the audience again, for the layman people, CPAP is a treatment. It's a machine
Exactly.
that is used once you are diagnosed with sleep apnea. Again, this is not something for you to follow on your own. please get in touch with your doctors, your therapists to understand a bit more about this. I will not suggest you Googling or chat GPTing things. Please get in touch with a professional because this has to be personalized, and this can be treated in most of the cases. If it's not treated, then there are other options that we can follow. So, Dr. Cheryl, this takes our conversation to something where we can discuss about what can people do now after watching this video, before they go and get in touch with the experts, that are there any breathing techniques that you can suggest for these people to try at home? Of course, it has to be supervised and everything is very personalized, but just if you can give us an idea on some breathing techniques that might help them give some relief before they take the next step to see the doctor.
Okay. So first you need to understand what is your breathing pattern. Just a second, I need to adjust.
Yeah, that would be very helpful, Doc.
Okay. First, you need to understand what's your breathing pattern. All the people who are listening to our Insta live today, I just want you to keep one your hand on your chest and one on your tummy, okay? And just take a deep breath. Just take a breath. So maximum of the people that I've come across, I would say, even the kids, the adults, what they do is, this is what they do.
Yeah.
This is okay. And so this is not deep breath. These are big breaths. This is a big breath. So
Correct.
when you breathe, when your tummy is up, okay, when your tummy rises up, when you breathe in, that is a deep breath. So that is a basic what we can do, because many times we have heard, like don't panic, take a deep breath, just relax. That is what they tell us, But we need to modify it to a pattern, just relax and breathe in from your nose. Okay, we just can't breathe in from our mouth. That is where we do a mistake. So breathing from your nose and rising your tummy when you breathe is something which is important. That is called relaxed deep breathing. We don't want big breaths,
Yeah.
We see a lot of many Insta accounts who actually tell about, take a deep breath and, but that's not how it works. When you take deep breaths, your parasympathetic system gets activated. So just the one simple exercise, that's diaphragmatic breathing. We also call it as tummy breathing, which will really help everyone. So see, it's not that if you have a lung condition, you do this, or if you have any disease. It's not disease specific. It's for your system. It's for your body. Okay. So keeping your hand on the tummy and just breathing in. So when you breathe from your nose, your tummy rises up, That is, I don't think you're able to look, but you can just try it on your own.
Yeah.
So not looking at your chest. This is wrong. This is not what we want. Okay. What we want is, it's just your tummy. So my hand, when I'm breathing, it's just my tummy which is moving. Okay. So that is how it works, which is really important when you tell me any specific exercise.
That's beautiful, Doc. And actually, we have forgotten how to breathe. Okay, so for keeping the sleep apnea aside, we don't know how to breathe. I mean, when somebody says that focus on breathing, we actually get very confused that breathing, this is how they start breathing, and forget everybody else. Even I, when I'm in a panic mode, and panic attacks have seriously gone up post-COVID. So I also don't know. I don't know how to breathe. So this is a very, very important point for everybody, whether you have sleep apnea or you don't have sleep apnea. It's important to get your focus back to your breath. This is not meditation. This is not something that requires 10,000 things to do. This is one basic thing that Dr. Cheryl just demonstrated. And this will be available on the record as well. So if somebody wants to understand a bit more, they can always come back to this video and see that. So that's great, Dr. Cheryl. So one is the tummy breathing, that's the diaphragmatic breathing. What else would you suggest to somebody specifically who is snoring at the moment before they take the next step? There are a lot of questions on myofunctional exercises. So can you put a bit of light on what myofunctional actually means for the layman population, and how do we go about it?
Okay. So, see, when it comes to sleep apnea, as I said, your tongue, which is a major muscle, tongue is a muscle which helps you, chew food, but at the same time, when you sleep, it goes into a relaxed state, okay? But the tongue going in a very relaxed state and in a weak state, like if it is super tired or, weak, that causes sleep apnea. Okay, so what we have to consider is strengthening your tongue muscle. We strengthen our biceps, we strengthen our, quadriceps, we go to gym, we exercise. But tongue is something which we really need to strengthen. Okay, so tongue is something we need to activate. The muscle has to work, work in a proper way. It has to move. It has to actually, we have to make him exercise. So tongue exercises is something which is a part of malfunctional oral exercises. So even face exercises. So all this are a part of treatment for sleep apnea. So once you feel you have snoring issues, first you need to understand what's the cause. Okay, you can visit an ENT surgeon, you can visit a chest physician. If you have other conditions along with it, to a physiotherapist. You need to understand what's the cause. Once the cause is clear, there's a proper diagnosis. There'll be treatment like tongue exercises in different ways that we prescribe you. We need to see, is it possible? See, because I'm not asking you all to try it on your own, because at times there is jaw pain. Okay, so obstructive sleep apnea also is due to some structural changes. The neck curvature of the neck. The way the posture is. So there are multiple reasons. So even the tongue exercises seem simple and easier. My advice would be consult your doctor, consult a physiotherapist, so that we can guide you in a very better way, because tongue exercises work amazing. We have also have research that when you do your tongue exercises, your memory, your connection with your, memory, your brain activity is really improved.
It's true.
So I think you can do that. It's really important because this is something new. So when I was practicing, I did a lot of research on that. I started practicing on my patients. It gives amazing results. Yeah.
Oh, absolutely. So, Dr. Cheryl, you are demonstrating, and my bad. I send them videos, which I shouldn't do. I'm going to stop doing that because I realized that, and it's okay, doctors make mistakes too. But before the live session, I learned so much today. So before the live session, I was sending them some YouTube videos where the person was demonstrating the myofunctional exercises. And this is for people who are not very comfortable going ahead with the treatment after the sleep apnea was diagnosed, and they were not so severe, so they could still do away with myofunctional exercises, and there were some amazing results. So within say 6 weeks of continuously doing the myofunctional exercises, the sleep apnea actually got better without getting it professionally treated. So these are few small things which we don't really pay a lot of attention to, but I think it is extremely important for us to start getting our attention towards this. So this has been very exciting, Dr. Cheryl. So if we have to summarize and give takeaways to the people who are listening to us and who will be listening to us, what would be your takeaway points?
Okay. So I would just say one thing, your sleep is really important. I was a person, I had a lot of sleep issues during my medical studies. People who are attending this might know me, I had a lot of sleep issues. My sleep was not right. And because of my sleep pattern getting disturbed, I had a lot of issues like, gastrointestinal disease, like few conditions of, puking and, getting stressed and depressed. But when diaphragmatic breathing, when nose breathing, when exercise became a part of my life, it was more easier for me. And when I started, of course, my patients are my best, teachers. They teach you, they make you. And when I was demonstrating things, I myself became relaxed paced. So the whole motto is you need to have a good sleep pattern. Make sure you sleep at least 6 to 8 hours, a proper sleep. What I mean is you don't get up tired, you get quite happy and you get up quite fresh. You don't snore, you don't like frequent urinations in the night. Your sleep decides how you are. Your sleep is an important part. And I just going through a few Instagram pages, and they also mention that you feel that you sleep less and you go for your workout. You sleep less and you focus more on your job. You sleep less and you focus more on your career. It's not going to work. You can't give your 100%. So when it is breathing, when it is night, when it's sleep, I would say pay attention to your breathing, which is like really important. Slow deep breaths makes you a person who you are. And the way I'm talking now, I was not the same person I was talking 2 years back. But when I was 2 years, when I was into my practice, it made me more cool, more calm. So breathing is something we need to pay attention. Then it's the night sleep, okay, to be very specific. The circadian rhythm is something which we need to focus on. your sleep pattern has to improve. And there are different tips, like we will have a more of Insta lives in future, where how to improve your sleep is really important. Reducing your screen time before you go to sleep, and so all these small things you need to jot in. Paying attention to your breathing and your proper sleep is something I would say focus on it. They're like basics. So yeah, thank you so much, Dr. Trishala.
Yeah, this was amazing, Dr. Cheryl. And sleep is something that cannot be covered in 30 minutes. And it it cannot be covered in the entire medical career. I mean, me and Dr. Cheryl, I'm sure we have not spent more than 2 pages of how sleep affects your health in our medical career. So that's the reason I had to step out and I had to do special courses to learn more about sleep and become a sleep coach, etc. But I could learn nothing in that what I've learned from my patients. So my patients are my teachers, like Dr. Cheryl just said, and there are so many tips and tricks that you will now find on Instagram page, and you will have health influencers without any health background giving you gyan on what to do, kaise sona hai, kaise nahi sona hai, and but applying it in your practical life is not so simple. So giving you instructions on sleeping early, get 8 hours bedtime, etc., is not as simple as we think it is. Okay, so I will appreciate if you guys take professional help, see the doctors, see the coaches, see the physiotherapists. There is help available around. You don't have to suffer. Start figuring out what is the root cause of your problems instead of simply just treating it from the top. So I always tell this to my patients that, if you are getting a burn, the burn is getting healed under the skin. So just simply applying the topical ointment is not going to be enough. You have to focus on your inner healing also. That's how it goes. And we will be coming up with more Instagram lives where we will specifically talk about sleep, breathing, and if there are any other suggestions that you guys have, you can share it with us. And it was amazing, Dr. Cheryl, to have you on this live session. I can't wait to speak more about it on different topics in future. So this was great, and thank you everybody for joining us. And whoever is going to watch the video after the live is done, please enjoy. And in case if you have any questions, if you want to get in touch with me or Dr. Cheryl, you can do it on our respective Instagram pages. You can do it on the .health medic, and you can do it on Dr. Cheryl's page, which is heart, lung,
Care,
you can care
yeah.
physio and rehab. You can simply type our names on Google and you will still get our information. So we are available everywhere. So if in case you guys need any help, we are very happy to help you, and we are very excited to come up with our next session soon. Thank you, Dr. Cheryl. It was amazing speaking to you.
Yes, thank you, Dr. Trishala. And the thing is, it's really great that we have more doctors. Like, I was really happy to, join in this session because we need to create more awareness, and that is what we are. So all the physios here who's listening, or all the medical professionals who are joined us today, we make a point that no matter what treatment are we giving, we emphasize a little of it on a sleep, on a breathing, because we have experts, we have specialized who are here to help us. So go to the right doctor, go to the right physiotherapist, and things will be more simpler. Yeah. Thank you so much
Take
once
help.
again for everyone.
Take help
Yeah.
is what both of us are telling.
Yeah.
Please take help.
Yes.
There are professionals out there, and please take the help from people who are professional. They are qualified. It's important to also know from where are you getting the information. Please don't blindly trust everything that you read on Instagram. It is important to get in touch with your doctors and health coaches. Thank you so much. We're signing off now. And in case if anybody has questions, you can reach out to us individually, and we will be very happy to answer that. Thank you so much. Have a good evening, everybody. Thank you, Dr. Cheryl.
Yeah. Thank you.
Take
Bye.
care. Bye.